Hey everyone, this is Dr. Ryan at Primal Chiropractic and Primal Elite Fitness. In this week's video blog, we're going to be discussing some strategies to eliminate your pain and discomfort. I just finished a Channel 4 interview, and one of the questions was, how do I approach back pain or just pain anywhere from head to toe? And what has given me the best results in practice is evaluating flexibility and mobility and strength and stability. And when we have a lack in one of these or both of these, you are a big candidate to having any sort of pain or discomfort. So we're going to break these two categories down to hopefully allow you to understand how you can stay out of pain and discomfort. We'll discuss flexibility and mobility first, just because it's a little bit easier to evaluate. There's angles and numbers that we can reference. So for example, if somebody comes in, we will start our range of motion tests with flexibility and mobility. And mobility is breaking down how well the joint can move. So for example, hip flexion. Can you get 120 degrees of pure hip flexion without compensation elsewhere? And we'll run through a bunch of tests. Flexibility is how well the muscle can lengthen. So it's not necessarily testing the joint anymore, it's seeing how tight or untight your muscles are. So to give you a quick example of that, a classic example is a straight leg test. So with keeping the leg straight, how much flexion of the hip can you get? And that's evaluating your hamstring muscle. Is it tight? Does it need work? Or are you in the clear? So we can start finding objective information on a great treatment plan taking this approach. Now on the opposite side of the spectrum, we have strength and stability. It's a little bit more complicated. It's not as easy with the number system. We're looking at balance. We're looking at faulty movement patterns. We're looking at fasciculations or potential shaking going on. Muscular cramps could be going on. To give you a couple of quick examples, just standing on one leg can be an easy stability test. Can you hold this for at least 30 seconds without flying all over the place or hip hiking or compensation elsewhere? Other tests, like a dead bug where you're on your back doing some leg lowers, can you first and foremost maintain form? Is there some shaking going on? That's also a sign that we're not as stable as we probably should be. And then when it comes to more global tests like a squat or a single leg deadlift, a deadlift, again, are we able to maintain proper form, load the spine correctly, etc. So once we figure out what needs to be done, we can then go into a very thorough treatment plan where we're making sure that is your flexibility and mobility on point, and is your strength and stability on point. And what we find is when both of these are firing well, not only are you going to be functioning at your best, but 9 times out of 10, you will not have any form of pain or discomfort. So if you guys have any further questions on these issues, please reach out to us. This is how we treat the vast majority of our musculoskeletal patients that range from head down to toe that we see some great results with.